Hi, everybody.
Hi. I just wanted to say a quick hello before Mary presents. I've worked most of my work life at the Odette Cancer Center, and so I'm not really familiar with the rest of Sunnybrook. So I'll count on many of you to introduce me and show me how things work outside of Odette. My name is Lynn Yam. I'm the new QA manager, and I'll be working very closely with Mary. So just wanted to say hi.
Hi, everybody. Is everybody settled in? Is there still a long line up there?
Yes.
Okay. I'm going to get started, though, because otherwise I won't get through all these slides. Okay, so the presentation today is based on the changes that are coming to Sunnybrook's practice for compounded sterile and non-sterile products based on the new Napra requirements. So most of the changes that are required are surrounding around the facility requirements, cleaning and facilities and equipment cleaning, personal protective equipment, and training and certification and recertification. Most of the changes are occurring in the hazardous drug preparation setting for safe handling, but also in the aseptic technique setting. Sorry, I'm not organized right here. So OCP is coming again. So to be prepared for the inspection on November 8th, the changes will become effective October 1st, 2018. So before we go into anything, I just wanted to read the preamble that is in the preparation and safe handling of hazardous drugs policy that we have here at Sunnybrook. And it states that Sunnybrook Health Sciences Center is committed to ensuring a safe environment for all staff. We recognize that some medications prescribed for patients create potential risks to the staff who handle these meds. So staff who either receive, store, transport, prepare, administer, or dispose of hazardous drug medications. So since there are no permissible levels of exposure, the policy is intended to provide containment of hazardous drugs without compromising asepsis in the preparation of these products. So let's start talking about what changes are coming, and we'll start with the easy to accept changes first. So when we look at our facilities and the requirement, the model standards for pharmacy compounding of hazardous sterile preparations does have requirements for a hazardous product storage area. So this area, and some of the areas are having construction done to incorporate these requirements, but this area is separate from an unpacking area. It's also a dedicated room, and it has to be a negative pressure room relative to the surrounding areas. And within that room, there has to be at least 12 total air exchanges per hour, with all air exhausted to the outside. So that just means that in 1 hour, at least 12 times, all the air is pumped out of the room and fresh air is pumped into the room. So you'll notice that there's check marks beside those. We're working on those or already have that. So again, from our policy for safe handling, there is a section there that is called best practice procedures that I just wanted to read to everyone. So the receiving and storage of hazardous drugs occurs in pharmacy stores, acute care, the Odette Cancer Center, manufacturing, and extended care. And the following procedures must be followed as applicable. Whenever reasonable, the unpacking area should be in a separate area. The areas must all have spill kits and hazardous drug disposal containers. So we've actually completed that. All the areas now are equipped with a spill kit. It's usually in a spill kit station that has extra items for you to help you clean the spill other than what's in the spill kit. A poster so that everyone has a guide how to clean a spill, because people tend to panic when a spill happens and forget everything that they've been taught. So the poster should always be in there. So some of the vendors shipping hazardous drugs will package them in separate totes and clearly mark them as hazardous drugs. Other vendors do not. So you need to be able to identify what's a hazardous drug and what's not. So all staff must be familiar with Sunnybrook's hazardous drug list. So the senior pharmacy technicians and managers of the area will have those posted for you so that they're available. But everyone should be really know the list so that you know if you have hazardous drugs within the pharmacy that you work in and which ones they are and how to handle them. It's really everyone's responsibility to be aware of what's on the hazardous drug list. You can find those lists on the pharmacy portal listed right under hazardous drugs. So let's look at the facilities and equipment cleaning. So the Hazardous Drug Committee worked really diligently on the policy and hammered out some definitions so that people know what kind of cleaning happens here, what kind of cleaning is required for our facilities and equipment, and to help you so that you know what agents that you have to use. So I wanted to go through those definitions so that everyone is clear on what we're doing. So cleaning and sanitizing. Cleaning is a mechanical process using detergent to remove dirt and debris. Sanitizing, using a germicidal, is a chemical process, and it's intended to decrease the number of microorganisms on clean surfaces to a safe level, and it prepares the surface for disinfection. Products combining both the detergent and germicidal properties may be used as a one-step process. And here at Sunnybrook, an example of that would be the Excel that we use. So we move over to deactivation. This is a cleaning process that renders a compound inert or inactive. It is the treatment of a hazardous drug with an agent, such as a chemical, that will render the hazardous drug less hazardous. And an example of this is Surface Safe Step 1 and Step 2. We don't use that at Sunnybrook anymore because it was corroding our hoods, but this is an example of a deactivating agent. Then there's decontamination. And this is a cleaning process that inactivates, neutralizes, or physically removes hazardous drug residues from non-disposable surfaces and transfers it to an absorbent disposable material appropriate for the area being cleaned. And an example of that would be the HD Clean Step 1 and 2 that we use here at Sunnybrook now. And then there's disinfection, a cleaning process of inhibiting or destroying the microorganisms not removed by cleaning and sanitizing. And an example of that is the 70% sterile isopropyl alcohol that we use. And then there's a sporicidal cleaning agent. So this is our new player in the game, and it's a chemical that destroys spores. And it is a required cleaning from Napra, and that's why it's been added on to our cleaning regimen. So understanding the definitions is important in order to apply them to the Napra requirements for cleaning and disinfection of the different types of sterile compounding rooms that we have. So I just wanted to touch on this about spray bottles. So the very first OCP inspection that we had, OCP stopped by in Odette, and as everybody knows, we have that big, huge window so everyone can see what we do in our IV room. And right off the bat, they nabbed us for having spray bottles in the IV room. And from that point on, word was sent out to the department that spray bottles are not acceptable. And the reason for that is you don't want to aerosolize any of the cleaning agents that you're using. So it's really for your own protection. But I'm hearing that there's still some spray bottles around in the department. So as of October 1st, possibly this afternoon, get rid of the spray bottles because we're not allowed to have them. Okay. So let's take a look at the Napra requirement for the clean room and the ante-rooms. So this is a bit of I printed out what I could find in Napra and put it in this chart. So for the sterile, hazardous, and non-hazardous IV preparation area, the Napra daily requirement for cleaning is that the primary engineering control needs to be cleaned. That's your hood. The counters in the IV room, the carts, the floors, and frequently touched surfaces such as doorknobs, switches, and chairs. Monthly, the walls, ceilings, shelves, and outer surfaces of the primary engineering control need to be cleaned. So when we're looking at the non-hazardous clean room and ante-room, Excel is an appropriate detergent. So you can use that on all the surfaces that you have to clean. In the hazardous drug preparation room, before the Excel is used, HD Clean Step 1 and Step 2 needs to be used. So HD Clean is the agent that is used to remove hazardous drugs from surfaces. Once the hazardous drugs have been removed, then you do your germicidal or microbial clean with the Excel TB. Okay, so that's a daily requirement for, again, the hood, the counters, the floors, and frequently touched surfaces such as doorknobs, switches, and chairs. Included on the list will be any parts of the clean room or ante-room that has shown contamination the last time we did hazardous drug wipe sampling. So if the results come back to us and we show that we have some contamination somewhere in that room, we will add that onto the list to be cleaned daily. I think this is just a double slide here. Okay, so pharmacy is responsible for cleaning the sterile preparation room. Napra doesn't have a preference for who cleans the sterile prep room or the ante room. It can be done by pharmacy staff or it can be done by environmental services. But pharmacy is responsible for ensuring the cleaning of the sterile preparation area is performed properly and that proper training has been given to anybody cleaning the staff. So if environmental services is cleaning your IV rooms, then we are required to give them the proper training on how to do that. And the training needs to be documented somewhere. So areas of training that must be covered: how to enter the clean rooms, so how to gown and scrub, put on PPE, the order that you put the PPE on, what equipments and surfaces need to be cleaned, how often they need to be cleaned, the cleaning direction, because I can guarantee that housekeeping is not trained on cleaning direction for IV rooms, so we have to teach them the principle of starting at the cleanest point and working your way out to the least cleanest point, and what agents are appropriate for what surfaces. So I just did this screenshot here from Napra. So the top part, the top screenshot is for the non-hazardous sterile preparation area, and the bottom one is for the hazardous. And I just wanted to draw your attention to the last three columns. So these are the people that are allowed to clean the clean room and ante room. It can be a pharmacist, it can be a pharmacy tech, it can be a pharmacy assistant, or it can be cleaning and disinfecting personnel. But whoever it is has to have proper training to make sure they're doing it appropriately. So before entering the controlled room, this is taken out of the Sunnybrook policy. And Napra also talks about assessing your personal condition, but this is how it is worded in our policy. If staff come to work when ill and are scheduled for a function that requires them to work in a clean room, they must check with the area's senior pharmacy technician or manager prior to performing their duties. And the reason that was written into our policy is because Napra actually lists conditions that may affect preparation quality. And this is taken straight from Napra. So uncontrolled weeping skin conditions, burns to the skin, including sunburn. So if you fell asleep in the sun on the weekend and you come in burnt with open sores, you can't work in the IV room. Cold sores, conjunctivitis, active respiratory infections with coughing, sneezing, or runny nose, fresh piercings that are visible, and other fresh wounds. Okay. So as we enter the controlled areas, we need to remove some articles of clothing and some other things, and we're going to go through everything that has to be removed. So you need to remove the following before you enter the ante room: overcoats and sweaters if they're not required while you're working, outdoor shoes. This is new. So Napra is now requiring that everyone has a pair of dedicated indoor shoes for when they're working in the IV room. All visible jewelry. These include earrings, both studs and danglers. So what's new here is that we used to make exceptions for stud earrings as long as you covered them with your hair cover, but they are not allowed. So whether they're danglers or stud earrings, they have to be removed. All rings, watches, bangles and bracelets, and dermal or permanent piercings, which we'll get to in the next slide, nail enhancements of any kind, and cell phones. Now cell phones creeps up every couple of years. We've always had this rule in place, but people seem to think that as long as they keep it in a Ziploc bag or it's only in the ante room that it's okay, but it's not. It's not allowed in the ante room, not even in a Ziploc bag. If you need to make a phone call or if you're waiting for a phone call, you'll have to use a landline. Some of the IV rooms have a landline in there, others don't, so you'll have to figure that out because no type of cell phone is allowed. So you might be wondering, what is a dermal or permanent piercing? These are dermal or permanent piercings. So aren't you glad this isn't your kid? Okay, so this is permanently embedded in her face. This ring does not come off. And yeah, I'm not sure about these. So anything that's visible that you cannot remove is not acceptable in the IV room. So when you get your piercings, make sure they are in places that are not visible if they're permanent. And the reason they are not allowed is because bacteria settles underneath them. They carry a lot of bacteria and it's impossible to clean them. So no longer accepted in the controlled area are cosmetics. Cosmetics of any kind. So this includes foundation, blush, eyeshadow, eyeliner, mascara, even clear mascara, false eyelashes, eyelash extensions, fresh tattoos. Now you'll notice here her skin is all inflamed with the fresh tattoo. But there's also a requirement that you cannot have a henna or paper tattoo. So that to me says that tattoos, fresh or otherwise. And illuminators, any skin illuminators. So any of the girls that like that J-Lo glow, no illuminators. Okay, let's talk about nail enhancements. So these include acrylic nails, biogel nails, silk wraps, shellac, regular nail polish, and long natural nails. So right in Napra, there is a stipulation that says that nails must be kept short and clean, and the Napra requirement is no more than 0.6 centimeters in length. Yeah. So I don't think we're going to have someone coming around to measure, so just keep your nails short. And that's just because we can't get the bacteria out from under them when you're doing your hand hygiene. Okay, so also very new is the appropriate attire for controlled areas. So most people wear scrubs in the IV room just because they're comfortable. So the Napra wording is that dedicated low shedding apparel suitable for controlled areas. For example, scrubs, but it doesn't have to be scrubs as long as they're low linting apparel that are not, dropping lint and fur balls. So other examples of acceptable clothing would be any clean trouser. I know a lot of our girls like their on-the-fly Lululemon pant. That's fine. Your favorite activewear, but I do have to say that if you're going to wear activewear, we do have a dress code policy in place. So if you look too much like you're going to the gym, you might be outside of the dress policy. So activewear is okay as long as you don't take it too far. Any dress pant, skirts or dresses with tights, your own scrubs, or scrubs from the hospital Scrub-X machine. So you can choose the comfort level. Whatever you choose to wear must be clean and put on once you arrive to work. So you can't drive in those scrubs, or you can't wear them on the bus. You have to put them on once you're inside the building and ready to go into the IV room. And they're not to be worn into work. They also need to be low shedding, so no Angora or feathery sweaters or linty sweaters. And your legs must fully be covered, as do your feet. And shoes must be dedicated for indoor use only and include socks. So that's very, very different. So I've already had, from yesterday's session, I've already had questions come back. Well, can you just put the fresh, clean scrubs over the clothes you wore to work? No, the idea is that you need clean clothes to go into the IV room. So any clothes that you wore into work have to come off. So if you are leaving the IV room and walking around the hospital indoors, that's okay. But if you decide that you want to go out for lunch or for a walk at lunch, you have to change back into your outdoor clothes and re-change back into your indoor clothes. Okay. So let's start the gowning process and walk through the requirement for entering into the IV room. So once you enter into the ante room, you are on the side of the line of demarcation that is considered the dirty side of the ante room. On that side, you're going to don your hair cover. So the new requirements for Napra are if you have long hair, and you can decide if your hair is long, if it's at least shoulder length and you can tie it back, then it's long hair. It must be tied up, and that's just so you can catch any thin strands that hang out of your hair cap. If you wear a scarf, you'll also need to put on a fresh scarf once you get to work. If you have a beard or you like to sport scruff, you'll have to wear a beard cover. So after all that has been taken care of, your mask is next, and then the booties. If you're in the non-hazardous drug prep room, then you're going to put on one pair of booties. Even though you're wearing clean indoor shoes, the bootie is still a requirement. If you're going into the hazardous drug prep room, you put on 2 pairs of booties. So once you've done all that, you're going to step over the line of demarcation into what we call the clean side of the ante room. And on this side, you're going to perform your hand hygiene. So there's a few new things coming out of Napra. So the first thing is that you're going to wash your hands with warm running water and germicidal soap for a minimum of 30 seconds. So it's 30 to 45 seconds. I couldn't find a picture with someone that didn't have a gown on, but you won't have your gown on at this point, which is counterintuitive to everything that we've done for many, many years. We used to put our gown on first, but starting October 1st, you will not put your gown on. You'll wash your hands first. And you need to include the forearms, and you also need to use a nail pick to get under your nail. So there's been much discussion about the scrub brushes that we use and that many pharmacy departments use. And Napra has decided that they are a no-no because they can rip up the skin, and so they are no longer acceptable. So if you still have those scrub brushes in your wherever you're scrubbing in, you can toss them. So we continue with PPE. So you dry your hands and your forearms with a lint-free paper towel, and then you use an alcohol-based hand rub. And after you use the hand rub, you put on your gown, and then you use the hand rub again. And most people are going, do we have to do it twice? You have to do it twice. Why? Because you're touching a gown that's not sterile. So they want you to do it twice. And there's a very specific way that the hand rub needs to be used. So you can have either mousse or gel, or you can have both. Some people prefer one and others prefer the other. You do your first pump into it, and you put your fingertips in one hand so that it gets under your nails, and then you spread it around your hands and forearms, and then you put your fingertips in the other palm to get it under your nails. And you do that for about 15 to 20 seconds. They're very specific about that in the Napra standards. So that is also very new. And then you continue with your PPE, as we always have. You don your sterile gloves and routinely disinfect them with the sterile 70% isopropyl alcohol. Okay. So let's review what you cannot wear. Nail enhancements, fresh tattoos, henna tattoos, visible piercings, any kind of jewelry, outdoor shoes, dirty clothes, meaning not freshly donned or washed, high linting clothing, shorts, dresses and skirts without leg coverings. So let's just look at the way we enter the hazardous drug clean room now. So this is specifically for the hazardous drug clean room. So when you walk in and you step into the ante room, you are standing on the dirty side aseptically of the line of demarcation. And then you cross over into the clean aseptically line of demarcation, and then you walk into your hazardous drug prep room. When you're leaving the room, when you come out of the clean room, although it's considered in that first part of ante room that you're walking into, although it's considered clean aseptically, it's also considered possibly dirty with cytotoxic agents. And then the other side, by the time you go through all your degowning and your scrubbing out, hopefully you haven't tracked any cytotoxic contaminants into that opposite side. So if we take a look at, let me just go back to the previous. If we take a look at these first two areas, the clean room and the clean side of the demarcation line, in that clean room, the new requirement is that you remove your blue chemo gown in the IV room before you step out into the ante room. And you're also going to remove the outer booty before you step into the ante room, which is also counterintuitive to everything that we've done since the beginning of time, because you would never think of walking into an IV room without a gown on, and now we're telling you to take the gown off in the IV room. But these are special procedures specifically for the hazardous drug room in order to protect everyone from bringing contaminants out of that room. So let's have a look at how this would look. So from our Sunnybrook policy, the outer gloves for the person that's preparing the hazardous drugs, they're removed in the biological safety cabinet when they're finished preparing whatever they're preparing, and then they're dropped into the Ziploc bag that's in the hood. Then that bag is sealed, and that goes in your red puncture-proof garbage. When we look at the blue chemotherapy gown, it's removed just prior to leaving the buffer room or the prep room. So people will release the waist belt and the Velcro neck closures, and then gently grasp the gown by the shoulders and inwardly fold it so that you don't transfer any contaminants that might be on the outside of the gown onto your scrubs, and discard in the red puncture-proof garbage. So it'll look like this. Step 1, undo the closures. Step 2, grab the shoulders. Step 3, inward fold. And step 4, drop it in the bin. Notice how the bin has now been placed right beside the door so that you can actually reach it. Then, when you have to remove your booties, the outer booties will be removed just prior to leaving the buffer room and placed in the red hazardous drug waste bin. So you also, you're going to need to rearrange stuff in your room so that you can do this. So you can see Isabella, pretty flexible. She can get it off. She dumps it in, then she does a spin and does the other one. So then in that first part of the ante room where you've now stepped, you're going to remove a portion of your personal protective equipment. Goggles are next. If you have finished for the day, you're going to wash the goggles and put them away. If the goggles are contaminated, don't wash them, just toss them and get a new pair the next day. Then after that, you're going to remove your mask. If it's the end of the day, you're going to be wearing a chemical cartridge mask. So you're going to unscrew the cartridges and discard them, and then clean the rest of the mask with the wipes that are provided to clean the chemical respirators. If it's not the end of the day and you're just going to the bathroom or going for a break, you'll be wearing either an N95 mask or a surgical mask, and you will discard that and grab a new one when you go back in. There's no recycling of N95s or surgical masks. Okay, and then your head cover is the last to come off, and it's removed and discarded, and then your inner glove will come off, and then you will perform hand hygiene, just in case any contaminants have transferred through your gloves or you touched your bare hands with your gloves. Dry your hands, remove the inner booties with the toweling that you're drying your hands with, and then step over the line of demarcation, and then do that with the other foot and leave the room. So we're going to move on to respiratory protection and what Napra is saying about that. So this is a screenshot of what's in Napra, and you'll notice that under activities, which is compounding of sterile hazardous product, the requirement is that if you're making chemo under the hood, you should be wearing an N95 mask or better, not a surgical mask. The chemical respirator mask has to be used for if you're manipulating anything where there is a splash risk, if you're cleaning up a spill, if you're cleaning the hoods at the end of the day, these are the biological safety cabinets after you've been preparing chemo all day, or if you're unpacking product and you suspect that there's breakage of a hazardous drug in there. So those are all the conditions that you are required to wear a chemical respirator mask. Now going back to the N95 mask, this is what it says in our hazardous drug policy. While an N95 mask is recommended and preferable when preparing hazardous drugs in a suitable and properly functioning biological safety cabinet placed in a negative pressure room and using a closed system transfer device within the biological safety cabinet, staff may choose to use a regular surgical mask with the understanding that while these masks are more comfortable, they may be less effective in preventing hazardous drugs. That is one long sentence, but basically, we are giving you the opportunity to choose for yourself. You know what the risk is. We'll allow people to use a surgical mask, but you are making an informed decision to use the surgical mask. Everyone in the department is fit tested for a N95 mask for pandemic. So they're on site for people that do choose to wear them while they're compounding. But they must be worn when staff are cleaning the IV prep room. So whether it's housekeeping that's cleaning or pharmacy that's cleaning, it doesn't matter. You still need an N95 mask. So the housekeeping people now have to be fit tested for N95 masks, and they have to be able to bring the one that they were fit tested for to clean the IV rooms. So let's look at our chemical respirators. Again, they must be used for cleaning the biological safety cabinet. So whenever your head, the recommendation to clean the hood is to try not to put your head into it, but unless you're 6'2", your whole upper body is going to be in there. So anytime that your head is in the hood for cleaning, whether it's a morning sanitizing or the end of the day decontamination, you need to use the chemical respirator. So the cartridges for the masks must be discarded at the end of the day. If some of you have been reading the leaflet that comes in with the cartridges, it does say that those cartridges are actually good for 8 hours. But OCHAL thought it was too onerous for people to have to record the time that they had it on and to keep track of how long they'd been using it before they discarded it. So they recommended that they're thrown out at the end of the day. Even though it's expensive, you throw them out at the end of the day. So there's also wipes, and when you, after you discard the cartridges, then you can wipe your mask down with the wipes that are provided. So let's move over to how we clean the hood. So you know that lately there's been all kinds of changes in how we clean the hood, and they're all Napra requirements. But we have some charts that are out there, but I still get a lot of questions from people. So hopefully now that we've gone through all the definitions, you understand better what agents you have to use at what time, but we're going to go through it anyway. So all the hoods at Sunnybrook, it doesn't matter vertical, horizontal, laminar airflow hood, biological safety cabinet, they all require this kind of cleaning daily. So a germicidal clean with or sanitizing and a disinfection. So the biological safety cabinets, on top of requiring the germicidal and sanitizing, they also require hazardous drug cleaning. So they'll require the germicide cleaning, the sanitizing plus disinfection, and then they also require HD clean to remove hazardous drugs from the surfaces. So yeah, it's a 5-step clean on these biological safety cabinets. It's about 40 minutes, about 40 minutes to clean the hood at the end of the day. Okay, so like I said, these are for all the hoods. On top of that, every hood, regardless of whether it's a laminar airflow hood or a biological safety cabinet, needs a once weekly sporicidal clean. And that's the new player, that is Paradox RTU. That's the sporicidal agent that we are using on the hoods once weekly. So these are the charts that we put together. Now this is all the hoods, and we've broken up the charts so that you can put them on just the hood that they're required to be on. So the first 2 columns are for regular laminar airflow hoods. So the hoods in D2's IV room where they don't prepare chemo, and manufacturing's big, huge room with all the hoods. This is the type of cleaning that they would get. They're not biological safety cabinets. So daily, they would be cleaned with Excel, which is the germicidal, followed by a rinse with sterile water, followed by disinfection with 70% isopropyl alcohol. Once a week, when you take the hood apart and clean underneath the work surface tray, the Excel is switched out for Paradox, which is the sporicidal clean. So once a week, the Excel gets switched out, the Paradox gets used, but the Paradox, in order to do a sporicidal clean, requires a 3-minute contact time or wet time. So when you're applying it on the hood, if you can't get it to stay wet for 3 minutes, you're probably not using enough of the sporicidal agent, so you might need to saturate your gauze a little bit more. Moving over to the other 3, these are for the biological safety cabinets, or cabinets where we prepare hazardous drugs. So now we've got a 5-step clean, and you'll notice that before the XL, HD1 and HD2 are used, and those are to remove hazardous drugs. Now I know a lot of the techs have been reading the outside package of HD1 and 2, and they've come to me and said, but it says that it's a detergent on step 1 of HD Clean 1. Why do we have to use another detergent after? And the simple reason is that the company that makes HD Clean, although they've tested it and proven that it does remove hazardous drugs from the surfaces, it hasn't been tested to show that it does the appropriate microbial clean to get the microbes off of the hood to be considered a germicidal clean. So until they finish that testing, I don't even know if they've started it, we had to use different agents. So now you'll do step 1, removal of HD, step 2, removal of HD, Paradox RTU, and that's for the sporicidal clean. It needs to be on for 3 minutes, rinse everything off for step 4, and final sanitizing with step 5. The last column really only pertains to Odette. We have one hood that is used only to mix BCG in, and so at the weekly clean, after the BCGs are done, we use the sporicidal agent, Paradox, with a 5-minute contact time. It inactivates, it's tuberculocidal, so that's what we need to take BCG off the hood. So nobody has to worry about that but the Odette people. So that's a lot of information on one chart. So the chart has been broken down for the first 2 columns, so you can put this on your laminar airflow hoods and not have to see any of the biological safety cabinet protocol. So once we started using this new sporicidal, the Paradox RTU, we found out very quickly how strong the smell is, how irritating it is. It was irritating people's lungs. People were getting headaches from it. So it was, sort of like we're protecting you from hazardous drugs, but we might kill you with the sporicide. So we referred to a couple of different references to see if there was a better way that we could do things. And so between the company itself and Critical Point from the US, they gave us a procedure that we could use to minimize the smell. So the very first thing to minimize the smell is that you would always be using a chemical respirator to do your sporicidal clean. Or for the people that, is everyone fit tested for a chemical respirator? Everybody? All the techs? Yeah? Okay. So everyone has a chemical respirator, so you should use that when you're using the sporicidal. So you're going to place sterile gauze in a Ziploc bag and add enough of the sporicidal agent to saturate the gauze. Don't overly saturate it because the more you put in the bag, the stronger the smell is. But you need to saturate it enough to get the wet time that you need on the surfaces. Keep it in the Ziploc bag and open the bag only when you need to retrieve some of the gauze to wipe with. And then the gauze that you've used, put it in a separate Ziploc bag and keep it shut. And that seems to be helping. It's a lot better. It's not perfect, but it does help. So the sporicidal agent, the requirement for now is to use it only on the primary engineering control. So when you're doing your monthly cleaning, you don't have to use it on your walls and your counters and your shelves. That is not required. It's only the primary engineering control for now. Okay. So one of the requirements that we are going to get dinged on because we just cannot get this together before OCP comes to visit us is every single vial. Actually, before I tell you that, there's an area for unpacking supplies. And what Napra says is that the space should be provided for unpacking supplies. It's to limit the presence of dust and particles in the anteroom. And supplies must be removed from cardboard boxes outside of the anteroom and disinfected with a sporicidal agent before being moved into the anteroom or into your clean room. So they're assuming that everybody stores their drugs and supplies in an anteroom. Our anteroom is not big enough to do that, neither is D2's. So it really, you just need to have all this done and clean before it enters into your clean room. So that means that every single vial that goes into any IV room, and you know how many vials we buy here, has to be wiped with a sporicidal agent before it goes in there. So it's going to be a huge job. And so we're going to have to determine who's going to do it, where are they going to do it, because it cannot be done in the same area that you store drugs, and what agent they will do it with, because it's very smelly and it's very irritating. And it's going to be a really big job. So start thinking about it, because all IV rooms will have to do this. No one will be excused from it. And so we'll have to come up with probably specific procedures for each IV room because we're all set up so differently. Those are the changes that are coming October 1st. Anyone have questions? Kelsey.
So the product that we use to wipe our chemical respirators is not removing HD products, correct? Like it doesn't lift the HD the way
It's not HD clean.
So should we also use the HD 1 and 2 on our mask if it's potentially been exposed to hazardous?
We'll have to look into that. I don't know what it's going to do to the rubber. So it might not be an appropriate agent, but we can look into that and find out. Yes?
So in an effort to keep the clean room as clean as possible with our PPE and with our scrubs or whatever is allowable there in this, you say you're bringing clean stuff from home. What about, there are people who have pets at home. So clean is relative to... So
clean is out of the laundry and you haven't worn it yet, and not the scrubs that your cat was sleeping on the night before. You know what I mean? Like clean out of the laundry, not worn. So yeah, people have pets, but hopefully they clean their houses enough so that there isn't cat hair and dog hair on stuff. Napra doesn't get that specific. Anybody else? I can't really see. I feel like I have the sun in my eye.
Okay.
Yes.
Just kind of tying into what she was saying. For those that are already working in the IV foods and already have their collection of scrubs that have been going in and out of the clean room, empty room, agent room, and whatnot, once this change comes,
just wash them. You just have to wash them.
As
Yeah, you don't need brand new scrubs. They just need to be clean.
It's already been exactly.
Yeah. Yeah.
Sorry, further that, I used to work at another hospital, and when we came out of the clean room to protect our scrubs, when we were going for lunch or whatever, we would wear a lab coat over top, so that when we went back into the anteroom, we removed the lab coat and the scrubs were still fine from having gone for lunch or even going outside.
I would say that's probably not okay. That's probably something that they did to sort of get around it, but they're very specific and clean. Yeah. I mean, if you want to wear, you're talking about just walking around the hospital.
Yeah.
Oh, they don't even say that you have to do that to walk around the hospital, but you could do that. There's no reason why you couldn't. Yes.
What if you were on a floor with an outbreak? Would you use the same scrubs?
I'm probably thinking that if your IV's for the day, you're not going on our floor. Right?
Each pharmacy does.
D2, where are you? Do you guys do rounds? So you do rounds and stuff too? I'll have to look into it. Probably not. I would say to be on the safe side. But again, Napra doesn't say. Yes?
So the smart models for all the supplies into the clean room, that's not just vials, but also like syringes, like packaged syringes.
It does say supplies. We were basing everything on vials.
Or even like IV bags, like the plain NS or T5, are those okay to wipe with this smart bottle?
Well, if you were going to wipe that with Sporcidal, I would say you have to wipe the outer package from the manufacturer, and then once you get into the IV room, open it up and it's sterile. But we may have to consider that as well.
Certain supplies, like for example, the needles or like the alcohol wipes, those are sort of like papery packaging, right?
Yeah. So the smaller sizes are in paper, and I think from 20 and up they're plastic, so they could be wiped. So that's Liam and I. That's our next hurdle. Anybody else? Maurice?
So, sometimes we need things like food mark. It's in a blister pack. We open the box, we cut them, so
Yeah.
it isn't.
That's fine. So if you're not manipulating, like opening them, you don't have to take further precautions. Yeah. So
HD drugs that count right.
sorry, I didn't
Sorry, the HD drugs that we
count under the oral soil. Mm-hmm.
so that would have to be right down as well.
The outside of the vials. Yeah.
So clinical trials as well.
Yeah, clinical trials is a whole nother animal. Kelly talked to me about that yesterday because they have their own set of rules. So we'll have to take a look at that as well.
What about clean areas to change into these clean clothes to wear in the IV room? Manufacturing, we have a washroom that's out in the hallway. I mean,
So you have that locker room over by KB 100. Yeah. So everyone's going to have to figure out a way, like a spot will help you with that. Find a spot for people to change. In Odette, we're looking at putting a bench in our wheelchair access bathroom because that's the only place we have space with some hooks for people's clothes that they wear into work. So we'll have to find space for them. Yes, Norris?
So, you see like how jobs in the shoe, like I know people like in scrubs, so I think
So, needless to say, I've already been approached by seniors about that, and it's like anything else. Yeah, you have to put on some scrubs, but you need to be ready for your shift with your scrubs on. Just like you make concessions to walk from the parking lot. You're here, but you're walking up from the parking lot. It takes 10 minutes, so you gotta make it work for you so you start your shift on time. Anybody else? Complaints? Questions? Question? Question somewhere? Sorry, can you speak a little louder? Every day something fresh. Yeah, every day a fresh set.
Can we not start getting the gowns from the machines like everybody else gets?
Oh yeah, if you want to use the ScrubX machine, that's up to you. Just I emailed them today to get some more registration forms. So yes, I mean Scott okayed that years ago when we went through this thing. So if you would like to use the ScrubX machine, you just have to fill out an application and then I'll send it in for you. And there is a charge to the department every time you get scrubs, but Scott was willing to take that on. And I think some people still do use the ScrubX machine. So that's open to you. I think there's some restrictions on, you can only have 3 pairs out and then they won't let you take any more out until you've returned some. But yeah, that's an option to you for sure.
So would we just email you for a form?
Sure. Just email me if you need it. And like I said, I emailed to get the forms today. So hopefully within the next couple of days.
Just to make sure, capris are not allowed. Your
So-
ankles have to be covered.
So you can wear capris, but you have to wear long socks because, yeah. So, you know, the goal is to cover as much of your skin as possible, unless we're wearing spacesuits, like our forehead skin is always going to be out and, you know, your cheek skin. But definitely shorter pants and short skirts. You have to wear tights or socks or something. I've been known to wear capris with socks. Anything else, anybody?
Where would we store these clean shoes?
Kels, okay, so that's an Odette issue. So everyone's got their one box. So hopefully you can combine your winter indoor shoes with your IV shoes. Now, you know, right in Napra, it actually says that those shoes for the IV room, they want you to disinfect them once a week. So I would say give your indoor shoes a good cleaning and then just keep them here. It doesn't matter that we're wearing 1 or 2 pairs of booties. They don't care. They still want them disinfected. I don't know. So maybe you're going to have to, like with cloth shoes and rubber shoes, I don't know what that's going to do. But yeah. Yes.
I was just saying,
Sorry, I can't hear you.
Would the department pay for like IV room specific Crocs for us?
So that question came up. I don't know. We have a new director. We can ask. Probably no.
but like there, yeah, certain shoes.
I'm just telling you the Napra standards. I don't know. I know Air Canada gets a shoe allowance, but. Sorry guys, there's a question here.
The disinfection of the shoes, is it enough to just throw it in your washer and that's disinfected, or are you talking about
Using
multiple
chemicals?
steps?
Using chemicals?
Yeah.
I don't know what they expect. Let me look into it, and we'll get back to you. Because not all shoes can be thrown into the washer. Norris?
Is the status quo for the station work?
No, it's just the clean rooms.
Okay, so everything's still the same.
Yeah. Yes. Thank you, Raina, for lunch.
I'm sorry for those I didn't get.
It's a big crowd.
Yeah, it's like.
Yeah.
I apologize, but lunch will be provided. I know there won't be this many people at each session, so it should be fine.
Thank you, everybody. If you have any questions that come up later, you can email me.